Good afternoon, everyone. Welcome to the King County Regional Homeless Authority regular meeting of the Continuum of Care Board and Advisory Committee. Today's date is January 4th, 2023. Time now is 2:10. Would like to apologize for those joining us from the public side of things for our late start. I'd like to start off with the land acknowledgement. Christy.
Thank you, Marvin. Thank you to my colleagues here, and thank you to the public for attending. I'm going to read the land acknowledgement from the United Way of King County. I read this yesterday, and I really like it since we work with them and they work with us. It says the United Way of King County acknowledges that we work on the unceded traditional land of the Coast Salish peoples, specifically the first people of Seattle, the Duwamish people, the original stewards of the land, past and present. We honor with gratitude the land itself and the Duwamish tribe. This acknowledgement only becomes meaningful when combined with accountable relationships and informed actions, and is a first step in honoring the land we are on and their people. We show our commitment to Indigenous people by direct fundings to groups led by and in support of Indigenous peoples. And I include people of Pacific Islanders, all Southeast Asian people, all Native American people, all people of all tribes and bands, including our brothers and sisters that are here from other countries. So I really like that, and I'm glad you like it too. I also wanted to let you know there was a precedent-setting case in the paper today about a Southern California beachfront property that was taken from a Black couple through eminent domain a century ago. And it was returned to their heirs last year. It's going to be sold back to Los Angeles County for nearly $20 million. And I hope that this precedent will play a part in the Indigenous peoples, in particular the Duwamish people, because Seattle is a lot like LA. So thank you for letting me share that. Let's have a good meeting. Let's remember while we're all here. Thank you, Marvin. Thank you, my colleagues.
Thank you, Christy. Catherine, will you do a roll call?
Sure, one moment, please. Okay, Tamara Bowman. Here. Reverend Dr. Kelly Brown. Lise Castro. Shanae Colston. Brianna Franco. Marvin Futrell.
Here.
Christy Hamilton.
I'm present.
Marisol Tapia Hopper. Benjamin Mishk. Noreen Hill Oneida. Linda Peoples. Christina Sawicki. Robin Tsuda. Karen Taylor.
Here.
Sherry Tillman.
Here.
Thank you. With 5 members present, we do not have quorum.
Thank you, Catherine. The plan for today's session is to review December's meeting minutes. Please ignore the typo on the agenda. If there are any edits needed, please let us know, and at our next public meeting, we'll take a vote on those. There's one additional item to be added to our meeting today, and that's an update from our System Performance Subcommittee's work. And we will do that right after public comment. And then we will get a 5-year plan briefing and spend some time on the planning for our annual Continuum of Care convening meeting and AC retreat. Is there anything else we wish to talk about at this time? If not, let's get started. Let's open up public comment. I will state as always that we keep public comment open to the end of our meeting. If there are folks now who would like time to speak, let's get that piece done. And if folks join us later and want to weigh in, let us know, and we will take time to hear them.
At this present time, I do not see any hands raised by attendees nor by panelists.
Thank you, Catherine. So I will lead off the first update. Applications for both the Continuum of Care Board and for System Performance and our CEA PAC subcommittees. Shanae and I reviewed them with staff, made sure all of the edits that were requested were done, and we will be posting them after this meeting. I don't know if there are people on the call from outside, but we want to open up to everyone that we are looking for new membership. For both.
Marvin?
Yep.
To interrupt there's a Ben Schroeder on the attendees list that has his hand raised. Could we let him speak, please?
Sure.
He's indicated that he wishes to speak. Thank you. Thanks, Jen.
Mic is open.
Hello.
Ben. Hello.
Hi. I put a little note in the chat too. Unfortunately, I have to leave like fairly quickly because I need to go to court and support one of my participants. But I am very interested in a member. I think you're looking for some, and I would be honored if I was nominated, but unfortunately I can't stick around for that. But I did want to let y'all know that I'm interested and I want to be an active member, so.
All right. Well, thank you, Ben. There should be a portal on the website following today's meeting, if no later by Thursday. By Thursday, we should have it up that you can let us know where you would like to support either System Performance or CEA or be on the Continuum of Care Board. And there will be a way for you to apply and let us know your interest so we can set up the next steps,
Okay.
as we move forward into 2023.
All righty.
Thank you, Ben.
And a happy new year to everyone.
Can I ask,
Yes,
Ben,
Karen.
where did you hear about the application for participants?
By coming to the meetings and not seeing a quorum repeatedly. I've been told that, the application's coming, it's coming. It's been coming for a couple of months now, but I'm waiting. I'm here. I'm trying.
Thank you.
Yeah.
I appreciate that. Thanks.
Yep.
Thank you, Ben. Has Jeff joined us on the call, Catherine? Am I on mute?
No, I'm checking the participants, the panelists. I do not see Jeff. Let me just ping him and send him another link. One moment.
If he joins us, great. If not, Christy, tomorrow, would you like to lead off the System Performance update?
Tamara.
Tamara,
Hello.
sorry.
So,
Happy New Year.
Happy New Year. Just a brief update in that we are checking in with everybody here on the board. If anybody wants to join the planning committee or the planning meetings, they are the first Wednesday of every month. And so we're trying to just document who wants to join that so that we're not leaving anybody out when those meetings come around. So if you are interested, let either Christy or myself know so that we can add you to the invite list. And then
And specifically that is for the advisory board members. And Sherry, I did.
Well,
mention you today. I knew that you wanted to be part of the meetings. I wasn't sure, or we weren't sure whether or not you wanted to come to the planning meetings or not, but that's why we're bringing this up right now.
I had been coming to those meetings and I spoke to Catherine about it. And matter of fact, I had to call her because myself and Lise and others were coming to the meetings, but there was no meeting. Like nobody ever showed up to facilitate or hold the meeting. So that was very confusing. Catherine, do you remember me contacting you about that and wondering, because they were on my calendar and I was going, but I didn't see you. I didn't see you two. I didn't see anybody there except for, like I said, myself, another person, and Lise.
Are you talking about the System Performance Committee meetings? Karen?
Well, I think so. That's why I asked Catherine, because I thought that's what it said, system performance. Yeah. And they were like, seeming like every day for like a week. It was weird. It was during the holidays and everything. So I was wondering, were those really?
Those were not system performance meetings. Those were just sessions, like a work plan session that Shanae was holding to get information from members, board members. And I was asked to set those up and I did.
And like Janelle points out, the December SPC meeting was canceled just due to its proximity to the holidays. I think a lot of meetings were postponed or canceled. But as a committee, Tamara and myself, Owen and Janelle and Sherry have been to these meetings. The planning meeting is on the first Wednesday of the month. The public SPC meeting is on the third Wednesday of the month. And we've been dutifully meeting for months at those times, Karen. So Sherry's got her hand up.
Yeah, I do. The last couple of times though, I've been trying to get on and I wasn't able to get on. And it's kind of frustrating because then I'm emailing everybody. Hold on one second.
I had to do the same thing this morning. I had to request a meeting link and I asked them to please do that at every meeting because I don't have it naturally embedded in my system for Google Meet or for Zoom. So I do understand that frustration, Sherry.
Yeah, that's sorry, I was trying to get it quiet in my background.
Oh, it's okay.
But anyway, yeah, if I can get that, that would be much appreciative because yeah, I missed a couple of meetings not being able to get on, and then I know people are not looking at their email, and so it's just kind of frustrating. Nobody's really responding back.
Thanks, Sherry. Janelle just wrote a chat message saying that she apologizes for that and she'll get you on the list. And we did address you specifically this morning for attendance that you had expressed interest. So we wanted to bring that out. Thanks for speaking up.
Thank you.
And just to continue the update, where we also looked at all three member applications that came in for the System Performance Committee from the community, and there's two from the King County and then one from YMCA, and trying to figure out like how we can refine our recruitment process. I personally went and went out for lunch with a colleague that I'm hoping to recruit. So I don't know if that personal touch is something that's helpful, but I know she's going to be applying at some point, I hope. So that's one of the questions or things I wanted to pose to the group. Also building on from the November meeting, our last public meeting, there was starting to review the annual work plan for HMIS governance and BitFocus, and a policy for new agencies who want to have access to HMIS that don't necessarily receive funding from KCRHA. So those things are in the works, and hopefully we'll receive approval or at a future SPC meeting. And then the last update was regarding Full Frame Initiative and my trip to North Carolina to be part of the inaugural Wellbeing Summit. it was amazing. And I'm starting to build on the action plans that we created there. And once I get the synthesized version, I'll send it out to the board and anybody else who's interested. And I would like to have it posted on the KCRHA website because this was groundbreaking. This was transformative. And this is exactly the line of, you know, the way I want to see our system be reoriented towards a focus on well-being, like individual and community. So that, yeah, it was life-changing. And so I will share that out when we get it, but I'm hoping that Tanya Tucker from the Wellbeing Blueprint will be able to help us facilitate like a workshop or something with respect to a future convening for the COC. So there's so much to learn and there's so many brilliant minds out there that we have so much to learn and from each other. And so like being in a group where there's different people from different sectors working on their respective issues, but have the commonality of well-being and wellness at the center of the work. I think that's really, really kind of new and exciting for at least for me. So I'm hoping that will be exciting for the rest of the folks on our board and future members. So be on the lookout for that, hopefully within the next week or two.
Good
Thanks,
report,
Tamara.
Tamara. I'd like to
Christie, did
add,
you have more to add? Because I heard
I
two
do.
action steps that I'd like to follow up on.
I do. I'd like to just point out again to the board that keeping in line with the new HUD mandates and the new questioning of HUD of how are we becoming more equitable and how are we incorporating wellness and full frame initiative guideline type items in our new policies. This is what the SBC committee is looking towards, is to reorient these policies based on HUD's guidelines. So it's real important that we know that we're not just trying to string along feel-good items to make ourselves look better as an organization, but these are actually HUD, if not mandates, they soon will be. They're part of what was incorporated in last year's NOFO and SNOFO. It's how are we actually achieving these goals for being equitable in our transmission. So I just want to add that and then stress that this is HUD guidelines we're following. Thanks, Tamara. Good report.
Thank you.
Thank you both. I want to
Marvin?
offer, yes,
Marvin, one thing, Board, I'd like to recognize Reverend Dr. Kelly Brown
welcome.
presence.
Thank you. Welcome, Dr. Kell.
Thank you. Friends, I'm in California for a family emergency and wanted to jump on just in case I was needed for a vote. But if not, I would like to be excused so that I can tend to the family concerns, but wanted to check in and say Happy New Year. And I think there's a retreat coming up at the church soon, so.
On the 12th, yeah, on the 12th.
Okay,
And that'll
all
be
right.
public, so we can carry any votes we need to that meeting.
Okay, perfect. Thank you so much, and I'll see you there.
Peace and blessings.
Peace to you.
Righty, I wanted to add to the SPC updates. We're still planning out the many areas we want to work on at our all-day retreat. And so I wanted to touch base with our board members if they would like space and time during that meeting to flesh out some of the working areas of the System Performance Subcommittee Work Group as we enter into 2023 at that meeting.
Heck yeah, it's pretty important stuff.
If you'd be so kind, if you can agendize how you would like to present, we can make it part of the documentation.
Sure,
All right. I'm up for it.
Okay.
How about you, Tamara?
absolutely.
Great. How much time do we need or how much time do we get? 10 minutes, 15?
We have 8 hours to fill. I would say if you want 10, 15 minutes, great. If you want 30 minutes, great. If you want a breakout group, great. We just kind of need to know what works best for the subcommittee group and work.
I think 15 is good.
I think 15 is
And
probably
did you? Yeah.
enough.
Okay.
Yeah.
it's in the notes, so we'll be using those to build this, so.
That's good.
Righty, thanks again. Is Jen still on the line?
He is.
Okay, we were looking forward to a 5-year plan brief. I know that it's had many, many drafts, but we were looking to get an update on where we were at with that, so.
All right, I don't see, is Jeff on the line yet?
There's a number 206-369-4630. I don't know who that is. But they're under the participants or panelists.
And what's the best way to unmute when you're on the phone, as a reminder?
*6, I think, or *9. I think it's *6.
Oh, okay. Hi. Yeah, this is Lise.
Oh, yay.
I accidentally joined as not a panelist at first, and then I hung up and called back, but I did not know. Yeah, this is my first time calling in, so I didn't know about the *6 thing. That explains why I didn't hear a response earlier.
Great. Glad we were able to introduce you, Lise, or make sure we recognize your attendance today. Hello, everybody. My name is Jen Ozawa. Yeah, Christy.
I was just going to say that whoever's hosting can change the number to Lisa's name. So
I'm doing that right now. Thank you.
thanks, Catherine. Sorry, Jennifer. Thank you.
No problem. Hello again, everybody. I'm Jen Ozawa. I use she, her pronouns, and I serve in the role of procurement and policy manager at KCRHA. Work very closely with Kelsey to co-lead the COC and work in conjunction closely with the board as well. Jeff Sims was unable to make it, it appears, to give an overview. Oh, or actually just in time to give, welcome Jeff, you're right on time, to give an overview and kind of update to the board on the current status of KCRHA's 5-year plan. I believe this is the maybe second or it's third time the board and this group has been briefed. Again, in an attempt to have this be a collaborative and sort of iterative process, which it has sort of been by nature. So we are at sort of the final draft of the plan, which the plan is really intended to be KCRHA's strategic plan over the next 5 years on how we plan to address homelessness as a region. And I'm going to kick it over to Jeff. He has some slides prepared to dive in further about the current state of the plan. Want to make sure that all board members are kind of in the loop and caught up on where we're at with it. And I will pass it over to Jeff with that said.
Thank you, Jen. You should be able to see a screen with the slides now. Who's still, Jen, can you tell me if everything is viewing okay? Great. Thank you, Peter. Thank you, Jen. So as Jen covered, we know that this is the third time at least, and then there's been many other conversations that each of you have been part of, separate from formal advisory committee meetings. And so some of these initial slides, I won't go, there's enough slides that I want to make sure you have time for comment and discussion in the time frame that we have. So I won't spend a lot of time on them. I also recognize that in many ways you're going to, we were aware that you're going to, that this group is going to look at these slides and be like, yeah, no, you already told us this piece. You already told us this piece. This presentation was made to the implementation board and to the governing committee in mid-December. And so even though we had previously interacted with this group to share the initial thinking on it and get input on metrics, goals, objectives, things like that, we wanted to just close the loop, as Jen said, and make sure you see what is now being put out there after we've gotten your input and seen, the graph. I mean, sometimes it's just the graphics that got added to it, but other times it might be a phrasing or a layout, and we want to make sure we're preserving that fidelity to the input that you all have given us. So with that, I'm going to scroll us through. As you can see, it's the first section is really going to just focus on first slides really just focused on what is our vision here. It was intended for a group that may not have necessarily been as engaged as this board has been with the work that we've been undertaking. So emphasizing that the evidence-based and data-driven approach to responding to homelessness, laying the framework of the baseline that we're talking about. And I know that this is not a number that is new to the people on this board, it's been done in fidelity with estimates and models that have been presented to you before. It also aligns with statewide methodology, that utilizes it. And we're constantly monitoring for any changes or updates that they're making. Per comments that I know that I've personally heard many of you make here, that we need to recognize also that not all that we're missing people, we're not capturing all of the experiences, and we need to be thinking about the true scale of homelessness that we need to be responding to. That's where the discussion of that we've had previously around the modeling and needing to serve about 23,000 people per year over the next 5 years has come into play. I know that we've walked through that in some detail before and how that was come up with. And then moving into what KCRHA's role should be in this 5-year plan and the specific things that we're focusing on. And again, I know that you all have seen this. We're going to shortly get into the 7 specific goals, and you've heard them all before. But reemphasizing where we came as the authority, it's something that I think emphasizing that really helps to fill the gap and set a baseline for people to work with us from. And a lot of times we have found that it's important to remind people that our role is to lead a unified approach to dramatically reduce the number of people that are experiencing homelessness in our communities, that it's moving away from a confused state. Hopefully this is a good graphic that kind of captures some conversations that we've had here about the state that we're in now, where we're also especially focused just on the scarcity of resources and organizing into a more efficient and successful system. And then actually, I think it's the next slide here, but then, it's 2 slides from now. Reorganizing that system being one of the primary things that we're undertaking. This was actually, I feel like this might have been a verbatim statement from someone on the advisory committee that it's not a mystery what solves homelessness, it's housing. And that's a focus of like what underpins all of our thinking and is underneath all the work that goes into the plan. And then this is the slide I had been thinking of. Our role as the authority and what we're trying to articulate in moving forward is to take a system that has a lot of good parts, other parts that are not functioning as well, getting things restructured so that it's equitable, so it's moving all in the right direction. It's moving in a streamlined way that centers the voice of people that have experienced homelessness, and then setting up that organized, structured system so that it can be expanded upon and optimized going further. And we've talked about that and the modeling and those numbers that just were up a little bit earlier in the slides. That's where that's all stemming from. So a lot of that, I think, apologies, this isn't, yeah, okay, we got a few more. These, for those of you that weren't aware, I'm sorry that I joined late. The actual presenters that were going to do this for you are both rather ill today. So I agreed to step in since I'm pretty familiar with the content too. So I'm sorry that I'm not quite as familiar with all the slides that they put together. These are some continuating pieces that lay the framework for folks so that they understand where we're coming from and where the 5-year plan is launching into. So reminding people of the timeline that we've undertaken, that this is not something that is coming out of a vacuum. In many ways, as well as everyone knows here, the item in the middle, the regional action framework, actually gave us some of our system goals verbatim, but all of these different reports have been building on each other. There have been numerous rounds of engagement with the community and getting affirmation and moving forward. And I think a consistent response is not that we don't have a sense of what we're doing, but that we've been told before and not done the thing we had been told to do. And so we're trying to not continue to ask the same thing, but instead identify that it has been a common theme and moving forward with it. There are some things that we've had really good progress to date on that I think it's important to keep in mind. Some of these areas where we've had that success and that progress are items that are the concrete ways that we will undertake a redesign of the system and an approach to work over the next 5 years to achieve the goals that we've laid out for ourselves. So there large number of interviews that underscored, this is the top left blue box here, that underscored a lot of that modeling work and assessing what kinds of housing models we need to focus on as a community. That all comes out of work that was undertaken this spring. Looking at the successes of the emergency housing voucher program and thinking about how we engage providers, how we undertake procurement equitably, those were some of the things that underpinned that success, and building on those kinds of lessons learned. The other pieces here about like the way we handle oversight, the way we focus on housing, just the things, the more rational and person-centered approach to a severe weather response that has seen, for example, over the summer where we saw dramatically dozens more people accessing a program that was set up for with the needs of those who were experiencing unsheltered homelessness, and at recognizing the needs not to just leave all of your items and go somewhere for a little while to cool off, but meeting them where they were at. I see that there's a hand up from Ms. Hamilton.
Thank you, Jeff. There's a question from Linda Chastain in the public comment section. She wants to know if this document is available to the public.
Yes, if you go to KCRHA's website, you'll see under the About Us tab, there's a list of boards and committees. The advisory committee is one of our boards or committees. I mean, it's got committee in the name, but it's one of our boards. And if you look for the HUD Continuum of Care, that's actually the link that I believe she would have taken to get to this meeting. And there should be materials that are listed there. And this is the PowerPoint that is posted up there.
Great. Thank you so much, Jeff. Was that
Of course.
clear for you, Linda?
Apologies, I can't see the chat while also sharing my screen. So thank you for filling me in on that.
You bet. That's where we try to help one another. Linda affirms that that was clear for her. So she says, thank you.
Of course. Yeah, and as someone, I can't handle when someone's scrolling for me. I need to have that as well. So that's just some of the progress that has informed our thinking in the 5-year plan. There have been some really dramatic successes in things like the emergency housing vouchers that we want to make sure we're utilizing those practices that that have succeeded. So now into the 5-year plan, I'll start slowing down a little bit. I know that this group didn't need all of that background that was really being provided in so many other places. As I said, we know that housing is the solution to homelessness. That's I know I won't receive any arguments with that here. And then as we presented to you before, there's 7 guiding that we had called them system goals. I believe that they're still presented in that way, but core principles that you'll see over, well, there's the 3 principles and then the 7 system goals. So first, and this is, these all stem from our theory of change that you can see in our founding documents. Homelessness is solvable. We solve it by centering the experiences, the real life experiences of people that have experienced homelessness and applying principles of equity and justice. And that is foundation to what RHA does, to the work that we're undertaking. And that continues to be the framework that we operate and the approach we take at all times. And then the 7 system goals that all of you had a chance to actually provide input on these, not only in their very early development before we really fleshed them out, but even back in, I believe it was November, might have been October. I was here presenting to you this list and looking at the pieces that are underneath each of them. We're going to go into that again today. So as a reaffirmation that we've gotten the feedback that you provided. And so we'll go through those in just a moment. But again, it looks like there's a hand up. So I just want to make sure that it's all covered.
Thank you, Jeff. Again, this is a comment from Peter. He said, reviewing the website, which I hope that he would. He's very good at that. It appears that this presentation was not posted with the other materials, but we will get it posted to the materials for today's meetings. So we'll hold you to that just to make sure that that's available for public. I just wanted to reiterate that. Thank you, Jeff. Yeah, absolutely. I apologize for that. I wasn't aware of that, that wasn't already available there. So thank you for clarifying that. So as on the 7 system goals that have been presented before, I'll quickly restate them. I think that the phrasing sometimes has changed a little bit, but they broadly are the same. So first, dramatically reducing unsheltered homelessness. Second, restructuring the service system to improve capacity and supports and efficiency. There's a lot of things that restructuring the system entails. Delivering accessible and accountable and responsive services. That especially has a lot of focus on like our ombuds office and the centering of people with lived experience and creating mechanisms by which that engagement can occur.
Reducing the impact of racism. We know that the disproportionate effect of homelessness by race is profound. And then the next three, that no family with children will be sleeping outside, so ending their unsheltered homelessness experience. Having every unaccompanied youth and young adult has a home, ending youth homelessness. And then the region acting as one to address homelessness, that unified response. I think our graphics earlier really helped to kind of take in a visual way and show what we're trying to accomplish. Those 7 goals are the same that we presented to you in the fall. And then I'm going to move through each one so you can see the objectives and the metrics that we presented to you again in the fall, but as you can see how they were presented to the implementation board and the governing committee. They have additional discussions. It was just the first presentation of those to those 2 groups. So in the coming months, there will be, I believe, at the end of January from the implementation board. And then I believe the sometime in either February or March for the governing committee. I'm not exactly sure on those dates. I believe some of them are still being scheduled. So that nothing has been passed or adopted at this point. It was an initial introduction of the material that you've given us input on. So first, to reduce unsheltered homelessness, the goals there, or the underlying objectives that we'd have to do in order to achieve that goal. Expanding temporary and permanent housing to meet our need, improve housing and supports for individuals, especially those with the most significant needs, assessing and updating our existing infrastructure, that partly is our system rebid, and scaling up Partnership for Zero. That's one of those successes and lessons learned that I put on the screen earlier, to achieve a functional zero of homelessness. There's some modeling that we've gone through in prior meetings, so I won't belabor that point here. As we've discussed before, it has been greatly informed by the input of people on this board, as well as the Lived Experience Coalition, and taking the state's methodology and duplicating that. So looking at our temporary housing need, you just couldn't see what the estimated need is, looking at our current stock and seeing where we need to still fill in spaces. So it's significant. We'd be talking about 23,000 people each year over the next 5 years. Of course, if we were effective at achieving this permanent housing development and creation, some of those temporary options are less necessary then. We don't have to put the resources into those if we had succeeded in creating the true solution of the permanent housing. Here are the temporary housing options. I know I walked through all these with you in the fall. And so these are unchanged, look a little bit prettier than what I put together for you. But you can see that recovery housing, recuperative housing, micro-modular shelter, and emergency housing, and then safe parking and RV parking all continue to be the 6 models. And as we discussed at the time, this really was developed through the input that members of this board and other members of the Lived Experience Coalition provided, looking at the data that we gathered last March to figure out, to understand the experiences of people and what the appropriate temporary response that they're looking for based on their needs. And then the same work went to, this is just showing, of the overall pie. This gives you a sense of like how much of those 7 things is being looked for. And then here's the permanent housing options. Same methodology to develop these. We've talked about many of these in the past in prior meetings. And when you put all of those on screen as well, you still have the temporary ones that are the first half. Here's the permanent housing pieces. And as we've discussed, these aren't all under the authority of KCRHA. Some of these actually, we are just a partner. We can provide the information, we can advocate for and support the development of, but we are not going to be the ones that actually control the implementation, the execution of creating those new units. I want to make sure I pause for a second and just give people a moment if they want a chance to chime in. I don't want to get too far astray of a place where you might have had a question. Okay, not seeing anything. I'm going to keep going. I think that we're about halfway through the slides.
Do you actually
Jeff,
one
I have
quick
a hand
question?
raised.
Oh, I'm sorry. I can't see that then. Please go ahead.
Oh, sorry, this is Tamara. I saw that congregate shared housing or communal living was identified as one of the options. I just wonder how much we're investing in that model, just given the like public health issues that are still permeating our society. So how much are we investing into that, and is that really a viable like housing model for folks? I'm just curious, because a lot of folks that I know personally, not necessarily in terms of my professional life, would prefer not to live with other people. So I'm just wondering if that's being considered, or I know we need to have more options, so this is a good option for folks who want it, but yeah, just concerned about the public health ramifications of that.
Yeah, no, absolutely. Thank you for raising that. That's a good pause to insert, actually. So thank you for doing that. So you can see here that shared communal housing, this is why we put this pie chart here. It's a really small slice. I mean, it's less than 1%. And really the work that was done, the examination of our HMIS data and the qualitative information that we received from all of those 600 interviews last spring, there were individuals that indicated that they would prefer and they would succeed more if they were sharing their living space with others. And so that is in the circumstances where that was information that we were given, we just extrapolated that out to understand, like, okay, so we need to make sure we are keeping that tool in our tool belt. And it doesn't have to be the tool we have the most of, but we need to have a few of those because that's what people would succeed with. And I think that builds on what we've said are our fundamental principles, that we're centering the voices of those who are most affected here and doing what they are articulating as the need.
Oh, thank you for that response. That's very helpful.
Sure.
And just on a related note with transitional housing, that because it's a temporary option, some of our programs tend to like not consider that a successful outcome if somebody wants transitional housing to like kind of build up their life skills before they move forward and take on full apartment rent. Is that going, I don't know if you're the right person to ask, but is that going to be changing with our local metrics and evaluation of programs? Just because I know that if somebody is expressing that they would prefer to have transitional housing, and yet our programs think that we're going to get dinged for like housing somebody in transitional housing instead of permanent housing, that I just want to know what the resolution is to that kind of tension there.
Mm-hmm. Yeah, absolutely. So I will lean into Peter to help me out with that part of that answer in just a moment. But I first want to just note that, let me go back to that first part of the pie. I feel like the pie pieces are useful because it gives you a sense of scale. You'll notice nothing here says transitional housing. They are temporary housing models. And what is not probably abundantly clear from the onset is that this is the increased pieces. That's why we started off with like, what is our gap? These are the additional pieces. And so transitional housing, that model where you can stay in this building with the rest of us for 2 years, and we're going to like, make sure you've got a lot of like services around you, and then you have to leave. That is not one of the pieces that are emphasized here as the model that would be increased above what we currently have. There are components of that kind of approach when you think about the needs of individuals that certainly like there's also not something that is labeled here as high acuity shelter. That doesn't mean that wouldn't appear here, because like there would be needs to make it, there would be various housing models by which you need to make sure that the service piece you're providing really provides the supports that someone that is struggling with a substance use disorder might need, or something like that. And so, so that's where, to your question about transitional housing, does it or does it not appear in what you see on this screen? That's the yes and no answer. But I think that your question also touched on our existing programs, which aren't reflected in what you see on screen here. And that's why I want to turn to you, Peter, so you can talk about, I know that it's months before anything else. So
before we turn to Peter, I have a question as well about this temporary housing projected need. When you talk about temporary housing, oftentimes does not last, and I just want to know why that's even in here, because like people get kicked out of temporary, transitional, if you will, housing all the time. There's all kind of tactics and reasons to push people out, whether it be their behavior, their mental health, their drug abuse, name calling, cuss outs, anger issues, what have you. And I don't know why this is in the plan as a need when the need is permanent housing. And so that's would be my question.
Thank you for highlighting that. And I didn't do a good job, I don't think, of covering that before. That the permanent housing pieces, so these models, or you can think of it as like all of these pieces of the pie. If we were successful in implementing all of these rapidly, like this year, all 100% of them, then I think you're perfectly capturing that we don't need this dramatic increase in these temporary kinds of models because we have moved people into the permanent place. That's the best response. The inclusion of these is out of realism around how the creation of those and the rate that it would take, that we're not going to flip a switch and how evolve those in 2 months.
Okay, I heard what you said, but I still don't see. I guess I don't follow. Somebody else want to help me because I don't understand why that is, like, seemingly in my mind a band-aid to the real issue, which is sustainable housing that people are able to maintain because they have the full wraparound support that goes with housing, medical, mental health, chemical dependency, things like that, healthcare, all those things go into, in my opinion, housing, or else the housing is not going to be sustainable. They're not going to be able to stay there. They're not going to make it. They're not going to make it through the hoop. They're going to be employees there that are going to abuse the authority, the power, and get people put out. That is what has been happening in these shelters, in these transitional housing programs.
Yeah, and I'm not sorry, and I think that everything you stated actually aligns with and is true and what we're putting in our plan there, that the need for all of those types of support, the many different types of services that you listed there, the recognition that those are essential is affirmed in the 5-year plan. And I maybe I misunderstood your question. I thought you were asking, why do we even have any of these temporary housing pieces? Why don't we only focus on these permanent ones? All of them, temporary or permanent, would need to continue to make sure that individuals have what they need for medical support, behavioral health supports, all the different types of services that you talked about. That would be present on both sides. The reason that the modeling that was done to estimate how much of what type of thing needs to be created doesn't just have 0 shelters in it, is because there's an awareness that we aren't going to be able to create all of these things overnight. And so we're going to have something that is a temporary stop, not to say that it doesn't provide the services that a person needs and the connections and the support that a person needs to be able to continue to get by, as Marvin would say, survive, in the interim until that permanent solution is there. And then that would be provided. And then also previously, and I feel like we've had, we discussed this in more depth when I was with you in the fall. The 5-year plan is KCRHA's 5-year plan. It's not, it's not the 5-year plan for the Child Welfare Agency or the housing authorities. So we're not writing, we can only go so far in what our role is. We won't be the holder of the assets and the production of housing, things like that. We are to be a partner in that. Our plan is to focus on the pieces that are under ours. And really what falls under RHA's control is the temporary housing pieces. And so that's where a focus on making sure that we have develop the right models, that we procure them equitably, that there are those who are being served have pathways to express a grievance if it needs to come up, things like that. Like those are things that we can control, and that's under our direct purview. And so our plan can talk about those things, and we can say, this is what we will do, and then we will do it. I hope that was more helpful. If not, I'm happy to keep trying. But if you give me a little more guidance on what you're looking for.
That's gonna have to do. I mean, that's what I thought I heard. And, you know, again, I don't see how that really is any change from what we already have going on. I don't see how that is really holding and caring for the community and making sure that they're able to thrive. I think that we've had temporary housing for many years that has not been sustainable housing, and people have not lasted there. The percentage of people that were able to get through the whole program and get into housing is very low.
I understand. I think that maybe what I'm perhaps not saying very well about the things that RHA can control and affect, and that in terms of how those temporary stops are handled and the types of services. It sounds like that's the space that you're maybe you're asking about. So I'm sorry for not understanding that at first, but a desire to do that more appropriately and with the recognition that we are trying to support people in their success stories, not punish them or just create more barriers for people as they're flowing through. And those are the types of changes that, as we reprocure a system, think about the types of services that are there, offer training and support for staff, and set up standards for like, this is what has to be offered here or not offered here. Hopefully that would address the kinds of things that you're raising. And that's certainly the types of things that over the next 5 years, RHA would be undertaking and is articulated as like the goals of the plan.
Christy has her hand up.
Thank you, Catherine. Thank you, Jeff. And thank you, Karen, for bringing that up. That's something that we've talked a lot about as a continuum of care and an advisory board, is to define what exactly aggregate housing is, what exactly collective housing is, what exactly is peer housing or cohort housing. And that's something as we develop and change policy to become more equitable, those are things that we want to look into. We know that the system is set up to not define these and fund these types of housing types, dwellings. But one of the comments in the attendees chat, Linda says she wanted to add to the conversation that there are organizations, specifically LBGT collectives, that have collective living models. And we talked about this. Native American cultures, of which I am one, has collective cohort type housing that we're more comfortable with. That is not listed as aggregate housing. So definition is real important here as we go forward. Culture is also something to incorporate in these. And again, what KCRHA can and can't do with respect to these. But as we change the paradigm, the language changes with it. And so hopefully we'll be incorporating peer, cohort, and collective housing into these aggregate housing measures, or expand what the definition is. So thank you for the opportunity to say that. And thank you for your comment, Linda.
Could you say, I want to make sure that we achieve that. Could you say, so you said peer, cohort, and congregate, is that what you said?
Well, we're looking at aggregate housing, right? In this chart, aggregate housing is one definition. We've got another idea of what collective housing is. In Native American communities, it's very common for generations to stay under one roof. The Longhouse is an example of Northwest culture where several generations will dwell in one dwelling. Linda, you're welcome. Cohort dwellings. You look at military or veterans as a cohort, they're very used to cohabitating in quarters. That was something that we looked at, renting larger houses with multiple bedrooms and being able to give vouchers to people who are used to cohabitating with one another. And then peer would be another word. So you've got peer housing, cohort housing, collective housing, which is different from the aggregate housing that you're looking at. So yeah, as we go forward, I just hope that we can incorporate these definitions to expand different living models, different cohabitation models, that one person, one apartment may be an outdated model. It may be 2 people in 2-bedroom dwelling that are separate households should become eligible. 5 people, 5 separate households in a 5-bedroom dwelling, that becomes fundable through HUD. So the definitions need to expand and change. And that's something that we bring up a lot. So it's just another type of model that I'd like to keep alive, introduce when we've got the opportunity to talk about it there. Thank you.
Were you able to capture all that, Jeff, or should we forward notes from this meeting?
Let's do both. I don't ever like relying just on what I captured.
Okay.
We are getting a little, I believe I'm only supposed to go till 3:15, so I will try to move quickly on the next few pieces. Let's see, we were on. I lost where we were at. Apologies. So this is the metrics around that first system goal. I believe that was the next slide that we were ready for.
Yes.
We had great, thank you. So these are the 4 different numbers that would be focused on as the indication that we are achieving success in implementing that goal. The number of people that are experiencing homelessness, the number of temporary and permanent housing units, because remember one of those metrics was scaling up the number of services, the number of services, programs, and facilities that serve high acuity individuals. Going, I think, a lot to what Karen raised about the meeting the needs of people and structuring service in a way that responds to their needs. And then the number of communities and number of people in Partnership for Zero and the number of people housed, or the number of people that we are successfully serving and communities that are at a functional zero of homelessness. The second one, or number 2, this is the second system goal. So the goal, as you see at the top, restructure the service system to improve capacity, supports, and efficiency. There are 7 objectives underneath of that. So again, the things you would have to do in order to achieve that goal. Prevention and diversion services, funding for services and operations, supporting frontline workers and stabilizing that workforce, redesigning outreach services, improving the severe weather response, having a more diverse portfolio of service providers, and standardizing person-centered healing and support. And I think that also goes, Karen, to what you were raising earlier in terms of the types of practices within these models that we would be seeking to encourage and advance to address what you talked about, people leaving, being forced out, and being left on their own. So those would be the goals. I think all of these we talked about before. There's a little bit more of a, I don't think we talked much about diversion and prevention when we discussed this before, but there was some modeling that was done around how many households could we likely prevent from experiencing homelessness if we had sufficient diversion and prevention funding. So this is what that model that's looking at those number of households. This is the number of households that we would anticipate we could prevent from ever having to experience homelessness with the diversion and prevention funding that would be part of our overall model of proposed increases. Severe weather, I talked about a little bit. Go ahead, Marvin.
I was just wondering, Christy, how that number, that 1175, how does that reflect now with what current inflation is and projected inflation numbers and what the market is doing?
That's a good question. I don't actually know that answer compared to our current number of people served. Does anyone else on the call know some number? I don't want to mislead with some guesses.
Okay, I'm just wondering, since this has, been a couple years and we've gone into quite a steep inflationary period here, that those numbers aren't maybe not going to be that rosy, just because we're working. Go ahead.
One of the key points here is about the funding keeping up with inflation. I think that's one of the key things that we are putting in front of our funders, is to ensure that does occur, so that this number would, that the dollar value would increase. It's the number that we think could be prevented using adequate diversion and prevention funding.
Okay, so that could be, this is an ideal number then, right? Because I'm thinking preventative diversion is probably funded least with our homelessness crisis. It's down the priority ladder for our other priorities right now. Is that true?
Yeah, it's certainly, like, if you looked at how much we spend on prevention and diversion compared to the total amount spent as a community on permanent supportive housing, PSH is gonna get far more funding. Some of that is also the nature of the intervention though. And it costs a lot more to build a building and then operate it than it does to one-time like, when someone's got a medical crisis that's put them on the verge and just help them pay rent for 1 month.
Agreed. Thank you, Jeff.
This is still under the second system goal, where it talked about, the severe weather response. This is RHA continues to refine and adjust the response that I'm getting short on time here. Our responses to severe weather. Obviously in December, we had some additional stand up of emergency shelters where people could go to. We had some very different approaches and models of providing services for heat over the summer, for example. And we're continuing to learn from those lessons every time we have a severe weather response and see what new things we could do. This talks about the support for frontline staff, stabilizing staff providers so that you have sufficient staff. I actually heard from someone earlier today. They're talking about, there's just not enough case managers at the program because their positions, they exist, they're just vacant. We need people there because they're the ones that are helping me locate the housing that I need and move on in that successful way. But there's no one in that position. It's vacant. They can't keep it filled. And this goes directly to that, addressing the wages that often people that are doing those positions are also eligible for the program.
$39 an hour is considered a low income wage.
In
Is
King
that what I'm
County.
reading?
Yeah, that's based on federal definitions. Yes.
Wow. It's a startling, fact there.
Yeah, that's an eye-opening slide. The more you stare at it, the more you see.
Under the federal guidelines, low income is 80% of the area median. And so as a relatively higher income area, that number is higher, but it also means that the purchasing power for any given household is lower based on that area median. It impacts all the rest.
Those stats seem so skewed to me because we know the people that we're dealing with aren't even close to this. So how do we change and skew those numbers to reflect what's really going on? How do we work on that? Whose domain is that?
I think part of it is just ensuring that we are entering this dialogue with a clear understanding of what the costs are and bringing that to the funders.
For the sake of time, I'm going to start moving very quickly here. Just apologize for not being a little bit more at the right pace. So the next, the measurements around that second system goal, I've got them on screen here. I'm not going to list all 8 of them. Once we make this material available, you'll be able to see it. And again, these were actually presented back in the fall. The slides didn't look as nice, but they were there. And in the material, you all received a grid in the fall that listed each one along with the objective and the associated metric that measures the objective. So you have like a nice document that fits on like 6 pages, basically, that also kind of summarize these. The third goal, delivering accessible, accountable, and responsive services. As you can see, when you look at the 4 objectives underneath that, this is really about the Ombuds Office and accountability and feedback channels. Give an idea of like ways that you have responsive services, and then some ideas to act upon that. But it's all about centering the needs and desires of those who utilize these services. The metrics by which we'd look at the success here. Yes, go ahead.
In addition to that last slide on 211, you might want to incorporate 988 as another resource.
Yeah. Yeah. Yes, I see it. Yeah, exactly. I see what you're saying. This the responsive service piece here is especially focused in this on the you're absolutely right to have 988 and making that awareness of service connection there. But it's also, like I said, it's focused on the responsiveness to individuals and ease of access and things like that. Here are the goals then to measure that. And I'm worried that in the next 2 minutes, I can't get through what is about 15 more slides. They have the same kind of layout. You'll see, so here we're on system goal 4, reduce the impact of racism. There's 3 objectives under that. Then each some further discussion on them, and then you get to how we measure the progress. And that goes through 4 more system goals, all of which has been shown to you before. So I'll show each slide so you have a chance to see it since it wasn't provided publicly. But I don't want to cut short your conversation.
So Jeff, let's allocate 10 extra minutes at this point in time, and if we need to come back, then we will take a barometer of the board members.
Also, I'd like to recognize that Shanae Colston is in the attendees list. So Shanae is here. Can we just get her over to the panelist?
Yep.
Catherine, thank you.
Okay. Okay, so we've got 10 more minutes. Let me go back to, so this is system goal 4, where I was starting to just skip through things quickly. The goal is reducing the impact of racism. The 3 objectives underneath it: centering equity across all services, improving our data collection to better understand how homelessness is experienced, and being accountable and transparent. And then we've talked about this, or I've said it a few times already. We're prioritizing equity because we know that we're all affected by racism and inequality. We also know that in the impacts of who experiences homelessness are exceptionally disproportionate based on race. And there's a listing here of various ways that systematically occurs. And then the measures here, data on how we achieve that goal, the data collection improvement plan with providers and communities that serve these populations. There's some places where we just don't have the answer yet. We need some help in developing that and undertaking the work to achieve those measures. So we are capturing it in a way that those who would be otherwise most impacted have said, yes, this is the right thing to be thinking about. Also looking at the percentage of our contracts that fund by and for organizations. It's not just the richest and longest serving agency, but the ones that are most connected with communities. And then the rate that BIPOC clients re-enter homelessness. So are we succeeding in ending homelessness for those disproportionately impacted populations? This would be the 5th system goal, that no family with children sleeps outside. You see underneath that 3 objectives. Improving coordination, so all families experiencing homelessness have a rapid pathway to housing. That's a domain by which that's more under the proximate control of RHA, helping to build those connection pathways, but also still scaling things up. Partnering with healthcare and education systems and other key systems to make sure that we're preventing homelessness and providing the wraparound supports, and expanding what we know works, scaling up those evidence-based interventions. This is I'm sure you've caught the cadence now. There's the statement of the goals and the objectives, some further detail about why that's in our plan or something that's substantive about it, and then moving to the metrics. So here, focusing on that, families with children are 17% of the people that experience homelessness, and most of those kids are under 10. I think that's similar to some of those other slides. It brings to awareness what impacts we're talking about and the kinds of urgency we should have. Then these are the metrics to measure our success in achieving this: the length of time that a family with children would experience homelessness, the proportion of those families that come and seek diversion and prevention assistance and are successfully diverted, and then our partnerships with healthcare systems, schools, those other systems, and actually achieving those partnerships in fulsome ways.
Jeff, read that first line on that slide.
How we measure progress on ensuring families with no families.
That's what I'm thinking. Yeah, just edit there. Okay.
Thank you.
Yeah, go ahead.
Slide 40. No, thank you. Yeah, we don't want that. This is where I'm really glad I can say these weren't my slides. It's not my fault. So I am still trying to go quickly here. I know that 10 minutes is not is achievable, but difficult. So please stop me or don't feel hesitant to interject if you have a question. The 6th one, this is our 6th overall goal. Every unaccompanied youth and young adult has a home. 4 objectives under that to achieve that goal: expanding housing and program interventions for youth and young adults, collaborating across systems to prevent and reduce inflow into homelessness for youth and young adults, integrating systems, strengths-based and healing approaches in our programs. I think this goes back to our earlier discussion about thinking about what helps a person succeed, not just kicks them out of a program. And then a coordinating body around youth and young adults to inform our system. That actually was directly brought up back in the fall when I was here meeting with you and presenting and running through this list. And that was actually one of the pieces that was raised, like making sure we included that in our list. I won't read all of these numbers because we're short on time, but again, like when you get into some of the details about what's going on here, there's just startling information that you learn about. And then the metrics for this particular goal would be around the number of youth and young adults that enter homelessness, contract funding for agencies that serve those youth and young adults, the operation of the Youth Advisory Board, and the number of providers that focus on youth and young adults, and measuring so basically, do we have the system pieces that serve them, and are we serving them and preventing homelessness for them? For the youth
I'm
and young
sorry, what
adults?
Youth Advisory Board or Youth Action Board are we talking about?
So actually, Peter, I want you to talk about that if you can for me instead, because you're going to be able to say it better.
The Youth Action Board is being reconstituted under the Lived Experience Coalition, and this is a youth advisory board, but it would be a youth advisory board that is reconstituted to serve the goals and needs of the continuum.
Okay, yeah, so there is already a pre-existing Youth Action Board, for those who weren't aware, that was created under the former COC, All Home, and all of the young people who have of course we've had a revolving membership of young people, people have come in, people have come out. But yeah, there are still people in the pre-existing Youth Action Board who are hoping to do this work, are still passionate about this work, and who had no part in the new Youth Action Board being created, and in the essential dumping and replacement of the pre-existing Youth Action Board. So yeah, just want to make sure that was on everybody's radar.
I think that I think that Peter makes a good point. The operation of a youth advisory board, I don't think that it was intended. I at least don't know the functional implementation of that. Which group and which faces at that table, who that is referring to exactly. It was meant to be a generic term of having that coordinated youth focused group.
Yeah, and I'm saying that would be like saying a COC board in the presence of this existing COC board. Because there are already young people who are passionate about this work and who are on board to do said work. And our last interaction was with plans of creating an MOU and plans of having staff to support our work. And we had resolved things and we were planning on going forward, and then that was kind of pulled up from under us, and then this new Youth Action Board was created. So again, making sure that that's on everybody's radar.
Yeah, thank you for pointing all that out.
That would be a good agenda item for next meeting, Lise. I propose that you
How
propose
about
it.
that? I propose it.
I second that if you need that, Marvin.
I don't need it. I am adding it to the wonderful legal pad of next steps and action items. So
Thanks, Lise.
I want to be, I want a little more direction. Is this something we want to tackle during our retreat? We could provide an adequate amount of time to continue that discussion, if that's one of the places, or do we want to do it at our next regular meeting?
Both sound great.
Both? Yeah, we could certainly bring it up at the retreat and then actually put it as an agenda item. What do you think, Lise?
Yes, please.
And done. Jeff, I'm gonna hand it back to you.
Great, thank you. We are on the last one, so we're almost there, almost home. So number 7, the goal is the Region X is 1 to address homelessness. Obviously, there's 39 cities in King County, and the authority was created to centralize the approach to responding to homelessness across all 39 of those cities and countywide. So the 4 objectives to achieve this goal: partnering with all of those to consolidate and streamline funding and services, elevating coordinated entry as the pathway that you access housing placement, developing coordinated and unique sub-regional implementation plans that respond to if an area that has certain needs or certain dearth of services, addressing that, and then supporting those across our region who need us most. And you can see the 4 population groups listed there. And the metrics to do so, the number of interlocal agreements, number of households placed into housing through coordinated entry, and the completion of sub-regional implementation plans, so that we actually have those plans completed and can begin working on them, as showing that we have achieved that consolidated single system and are moving forward with its action. Let's see. With that, I know I'm already over time, so I'll turn it over for any last comments or questions.
Jeff, I submitted one chat comment to you from one of the attendees.
Okay, give me just a moment. I'm going to stop sharing my screen so I can finally see the chat again. Healing approaches. I think that's an appropriate, that's a good question, because there are various best practices for some individuals. The right approach they might need might be a sober housing situation, whereas others need low barrier housing. So that's why you have a term that is a little vague there. Its intent instead would be more program specific, but there are a lot of something like I'm struggling. Gosh, I'm really struggling with an example here. Karen earlier was talking about the being kicked out of a program because of certain types of behavior. Having programs that are set with low barriers and are restorative and work with individuals through the areas that challenge them, rather than just resorting to kicking somebody out, they weren't a good fit, but instead working with them to address that and the proper staffing to do so, things like that. That'd be a healing approach rather than a punitive approach. And that was what the goal was meant to convey there. I hope that is helpful.
Are there other questions? Any other?
Thank you, Jeff.
I too thank you. I also wanted to ask, I love presentations, I love slides. When will the document of the 5-year plan be ready to share with folks? I'm sure it's sizable by now, but where the fine print actually meets the intended goals of
I don't know the exact date. I'm not the person that is making that decision and monitoring the development of the document to that level. My understanding is it will be in January, maybe like within the next couple of weeks here, if not earlier than that, but I don't know that answer for sure.
Thank you. All right. Are there any other questions? If they're not, I wanted to move us along to our convening for the Continuum of Care Board and our advisory committee retreat.
Yeah, Marvin.
I'm sorry, go ahead.
I noticed that Shanae is still listed in the attendees and she's not here on the panel, but we do have 7 members present. Isn't that now a quorum for as many members as we have? If you needed to vote on the minutes or whatever, yeah.
I would have, Catherine, have we
I
reached
did
quorum?
promote Shanae.
No, you promoted Courtney Love.
Oh, okay, hold on.
She, as of yet, is not a member of the board.
There I see her on the board panel now, yeah.
I see Shanae now. Shanae, are you there?
Yeah, I'm here. Sorry. You need me?
We always need you, Shanae. But I'm glad you're here. We're moving on to the agenda, to the planning of the retreat. I know we have a meeting and on on Friday to also continue the planning, but I wanted to take away from today and make sure that we got it on the record of some of the things that the board has said they would like to be part of our working agenda for our all-day retreat. So I'll start. Sinead, feel free to weigh in because I just got back and I know I haven't added much to this over the last 2 weeks. So if there are things that I don't have, let me know.
Okay.
All right. It's the board's wish that our retreat be in person. I think we've been able to do that. Our board member, Dr. Kelly Brown, we will be hosting our retreat at her church. It was expressed early on that we set aside time for us to check in with one another, meet with one another, and figure out what it is that we want to do. Over the last several months, we have identified that the System Performance Committee, the CEA PAC, the NOFO, system redesign, and today we've added the YAB, were the subcommittees that we really wanted to work on to learn, not only know about them, but the role, the responsibility, and the constitution that we may need for filling slots on all of those boards. There's also clearly over all of our time here, a need to clarify what is the Continuum of Care Board role and responsibilities to HUD and the advisory committee role in which we've also taken up role and responsibilities to the KCRHA. And also how we planned, well, along with that, learning those roles is how does the full frame initiative and well-being guiding our work as we move forward. Then I have getting clarity in how to implement planning and educational sessions that don't have to be public, but they need to be in spaces that one, acknowledge the time that board members are putting in and actually be of use to us in terms of understanding the many things that are brought to the board. Folks from CHS will be on board. I do remember, Sinead, correct me if I'm wrong, that they were committed to helping us with the different models or how-tos for reconstituting or the constitution of subcommittees, our board, and how do we recruit, and getting a better working on that. So as we reach out to the community, we're doing so in an effective way. And then there's outreach communications. Oh, Lord, I die.
Marvin, we
Did
lost
we
you.
lose him? Christy, what's your question? You got your hand up.
Yeah, I've got a couple questions here. Okay, so I got the where, Kelly's church. I don't know where Kelly's church is. I don't know when or what time, what date.
Yep, all that'll come out after we meet with the people at CSA.
Excuse me, I'm trying to answer her.
Can you send it in?
It's Plymouth Church, downtown on 6th Avenue,
I'm just checking the staff.
downtown Seattle, and it's supposed to be on the 12th of January.
What time?
I'm not sure about the time.
Okay.
I heard it earlier, but I don't remember what he said.
It's the first
Gonna
I've heard.
start at
Thank you,
8
Karen.
o'clock with a light breakfast,
What time?
at 8 a.m. The first hour is going to be a light breakfast and conversation, meet and greet type. And the actual retreat with presentations and so on and so forth will begin at 9 with a lunch that will be provided and will end at 5 p.m.
Okay, that's more information than I had before. Thank you.
I'm sorry, did we already got information about this already?
I never got information. This is my
Yeah, I
first.
didn't either.
The information has not been sent out yet. The
Okay, great.
information will be sent out this week.
Thank you so much.
Sorry
Again,
about
the
that,
information will
guys.
come out officially after me and Marvin meet with the CSH and formalize
you.
the outline of the agenda.
My apologies. I lost power.
As a daughter.
I hate when that happens. I've got another couple of items I'd like to post if we've got time in this retreat, Marvin, is on your planning sessions. I'd like us to talk about chain of command with regards to the advisory committee, the governance committee, and the implementation board, and regarding our subcommittees, and also internal communications. We really need to talk about internal communications. And then another thing we talked about earlier in one of our planning committee meetings was looking at how well the LEC works. They read guidelines at every meeting. I'd like to see us maybe implement that, or that's something we can talk about. Guidelines for how to have a productive meeting for our COC. So not only external communications, but I really believe that we could stand to work on internal communications. I know I could.
So community agreements, so I have it written down, our community agreements for operating a good meeting and our mission. I think that's what we don't read every time we get started, and we probably should.
Well, one of the things that we talked about is that a lot of times we'll get derailed and we won't focus on our agenda. So if we've got a plan of action for somebody who brings up something that's pertinent to them, we can refer them to, this isn't the venue for you to talk about this, but here's a place you can go to discuss this issue. Let's move on. So we can keep ourselves at a basic business minimum and keep to our agendas, because we're talking about how we rarely get to finish our agendas. So if there's some sort of guidelines that we can read or have the communication wise, internally and externally, where could this person go to find this answer? Like today, this one of the attendees asked where this information was for the public. Peter and Jeff both gave us, documentation as to where to find that link. Then it was found out it's not there. Okay, we'll problem solve that. We'll get that to you by Thursday or whatever. So those are the kinds of things that a good meeting will have. Gosh, I don't know, but here's what we'll find out for you. So, and that helps to move things along so we don't get mired in the emotionalism and wallow in stuff that doesn't have anything to do with our committee meeting. So, and the chain of command too, what's our responsibilities? I mean, you brought that up again, but our advisory committee meeting has some definite HUD mandates that we need to follow, and we haven't been, and it's important to discuss those and discuss those things that are criteria. It's not just wish lists. We're not just taking up time. These are HUD mandates that need to be followed, and that we're not doing that. And so we need to revisit those. So that would be chain of command, or again, external, internal communications.
I'm not in agreement with following any system that's failed the community, nor am I in agreement with making this meeting an LEC meeting or following LEC's meeting guidelines. You can read the rules or read the guidelines all you want. Reading them and follow them is two different things. I think it would be a waste of our time. Again, this isn't an LEC meeting. And I think that some people's emotions and passion are valid and should be respected because of what they've gone through.
You can disagree, Karen. That's why we're here.
Well, I'm going to call chair again, because once again, everybody's opinion is valid.
Right.
As a board, we will determine together how we plan to proceed forward, but I want everybody to be able to speak openly and freely so that we hear all sides of an argument so that we might craft the best course that brings everyone along. Okay,
And that
so
doesn't always happen, Marvin. So I agree with you
understand.
there. I agree with you there that we need to be an open entity. And so to foster and foment communications internally and recognize who we are and what our purview is essential to us functioning as a board that actually functions.
Okay, got it. Did I miss anything when I dropped off that anybody else wanted to add to what we were going to try to make work into our day's events?
Hi, this is Tamara. The only thing that I would maybe suggest is that we start off with intention setting and maybe reviewing the community guidelines that we had set up when we first were onboarded.
Yes.
And either revising them or like refreshing our memory, like more than, once a year. That would be good, because I think that might help mitigate some of the tension. And then also recruiting for the new membership. That one's really high up on my list.
Okay, let's put that too.
Also, is this, is our function here that's gonna happen on the 12th at this church, is this for the board members only, or is this for public attendance?
It's for board members. It's an in-person gathering for the board members.
Okay,
There will be portions of the meeting that will be public, usually probably generated around, I'm gonna have to double check with Peter, so I don't wanna,
No, the whole thing has to be public.
right, okay, thank you, Shanae.
Yeah,
Are we
it is-
gonna-
it is a public meeting that will be recorded and all those good things that we always have. It is a public meeting.
so it's gonna be a hybrid then? We're gonna have hybrid, Shanae?
It is in person
Or
at
in
the church.
person? Okay, and recorded, meaning we're not.
For the
going to-
board members, it is an in-person retreat.
Thank you.
For public attendees and other non-panelists, they will have access to a Zoom setup.
Okay, so it will be
so that-
hybrid. Okay.
Yeah,
thanks.
so that they
Okay.
could at least see us and we can, hear and speak
Right.
to them for like public comment and such.
Yeah, that's hybrid. Thanks, Shanae.
Yeah, sorry, I just didn't know the name, but I know it's happening.
Thank you.
Gotcha.
Any other suggestions for the next step with our plan?
Well, I just want to hear from you guys. It was really shitty. Me and Catherine tried a couple times. There was a lot of technology challenges in regards to our listening sessions that we had set up. And so I really would like to take this time. If there's anything that any of our board members want to add to the agenda that me and Marvin need to speak to CSH about and coordinate, if you could please share that now so that we could record that and bring your guys' voice to that table as well. We did leave some room in our own planning and agenda on top of what we've already discussed for quite some time as a team, for individuals and, smaller groups and things to be bringing those awareness to us as well.
I think we added one, I think before you were on the call, Shanae, that Tamara and I are gonna do a 15-minute outline for SPC at the retreat. So that was offered to us early in the meeting today. So I know we're gonna be talking about that. It's 15 minutes out of 8 hours. Cats, will there be cats at this meeting, Jen?
I don't know that we want to invite her. She's usually not this friendly.
Mine is under the blankets on the couch. She rarely goes under there, so I don't know what's going on with that.
I might want to suggest what partnerships we that are currently absent from the system or from the homeless response system and how we can develop those. There are so many, and I would like to see like partnerships that address different domains of a person's life. Because housing is definitely one, but what about healthcare or the education or child welfare, or having representatives from different systems, and certainly, of course, like prioritizing folks with lived experience. But yeah, that's another one. Brainstorming different partnerships and creating a network of solutions that might help us truly reduce, if not end, homelessness.
Our ideal board, Tamara.
So I really, just to make sure I captured it, let's brainstorm partnerships for the full spectrum of those experiencing displacement in our communities. With part of that being learning what partnerships we have now that we inherited and how to get new ones. Okay.
Yeah. And I guess to piggyback on that, and this might be part of a different conversation, but like for partnerships that have been toxic or have created harm for our communities or ourselves, not trying to like throw anybody under the bus, but like we should also talk about accountability and what that actually looks like for our community, because it might not look the same for folks. So can we define a community-based definition?
And I'm going to link this with the work that we're going to start doing with the system redesign.
Yay.
Because I think there's a few other pieces to that system redesign, including how we're funding, who we're funding, and yeah. But partnerships is another good piece to that one. All right. Are there others?
Do we have time on a different topic to talk about applications for new members to the board? Have we had any?
Yes, we can. And if we're done, if everyone's weighed in on what they'd like to see, we can move on to our other committee discussions. We leave space open for that, and that's probably a good topic.
Jen has her hand up. Jen Ozawa has her hand up.
Yeah, thank you. Just a clarifying question, when we're talking about the system redesign, are we talking about COC dollars only, or are we talking about KCRHA's whole funding portfolio?
COC dollars only.
Okay.
It's a COC convening. It is not a KCRHA convening.
Thank you for clarifying. Perfect.
And then Christy, can you repeat your question in regards to the application process? What did you just say?
Oh, on our agenda, Shanae, we had application for new members slated from 2:30 to 2:45, and we didn't get to that. So I was asking Marvin if we had new candidates for our board and whether or not we could discuss that. And if not now, can we bring that up at our retreat?
It is definitely a subject for the retreat.
Yes.
We have planned time for that specifically. Okay. We did go ahead and revamp the application as per our board's discrepancy last time. And so those edits have been made. We've asked for a job description to be detailed, right? Reflecting again, what we said, an increase in our hours and kind of getting more into the, for lack of better words, right? The nit and gritty and the details of the work that we're expecting others to join and do. And then in regards to the certain seats and the positions that those people hold on those seats. And so that is hopeful to be all presented to us, come to our retreat, and then officially like launched and know every hall that we're going to start receiving applications and going through that interview process for both the COC and the CEA, as well as our subcommittee. So all three of those applications and interviews will be basically going real live and just be planned as board members that will be expecting at least a few of you to show up to these various interviews and ask these curious questions in regards to the applicants and candidates that want to serve with us.
Thank you, Shanae. That leaves me with the question about the liaison position. Can you further clarify that?
Is that the one that we did the interview with, right? You was there?
Yes. Yes.
Yeah. Go ahead, ask away.
We had one of those interviews yesterday. I believe we've got another second interview or two more second interviews on Thursday. And this is for
Correct.
the COC liaison position that we had
Correct.
been talking about. Okay. Do we have a scope of practice, excuse me, it's nursing terms. Do we have a job description for that liaison position? If so, where can I find that?
That position is posted on the KCRHA website, so I'll drop the link in the chat, okay?
Thank you, Peter. You're just my favorite Google person here, Dr. Google, I'm calling Peter Google. Thank
And
you.
just to clarify, it's a coordinator position. So when you're looking up the title, it's coordinator.
Okay, thank you, Jen.
DLC coordinator.
Thank you.
Mhm.
And they're gonna be a wizard at
And if anybody
communication.
else wants to be showing up to those interviews, it's great to be there, right? To give a sense of presence of what what vibe you're getting from these people. There are standard questions that KCRHA, Kelsey, Jen, and Karen have decided that are mandatory to be asked in that second interview. And then there is time for us as board members to ask curious questions, open-ended questions, and clarifying. One of the questions that I personally asked the candidate Linda yesterday was if she could identify a social identity that affords her power, and then describe on how she can be a good steward of the power that comes with that privilege she's afforded. And so those are just one of that was just my question in regards to like how these people are going to be showing up, what lenses are they using, right? And so just being aware, please bring that as well to the table, because they are essentially going to be working for us, right? They're coordinating our services and care that we are requiring and demanding and sometimes begging, and this is supposed to eliminate some of that, right? Some other hard questions as we asked on how, when there are those differences, how are they going to show up in support of the resistance that we've always felt, right? And that pushback. And so really asking people's values, how they plan on, what tools they plan on using to represent and advocate for us in these difficult conversations. So things like that is what we're expecting answers from in regards to the next two candidates as well.
My hand raised. Can you guys see my hand? And can you hear me?
Yes.
I can hear you.
Yes,
I
we
cannot
can
see
hear
your
you.
hand.
Okay. I just
There it
want to,
is.
I just need to say, can you hear me?
Yes.
Okay, hold on. I'm going in the building. I need to say this because I mean, I cannot move the way they move. I will never, ever be able to bring myself to mimic what these oppressive, racist systems, disrespect of our culture are trying to seemingly, in my opinion, force upon me. Like to say
Karen, we lost you.
can you hear me?
Now we can. Okay, you're going in and out. Right now, we cannot hear you.
And then we have to move to the beat of their drum. When are we going to be allowed to be Black? When are we going to be allowed to be Native or Hispanic or Filipino? Why are we always having to dance to the beat of a white drum? I'm sick of that, and I cannot do that. You know, I raise my voice, I yell and scream, I cuss, I argue. That is just who I am. That is the life I had to live. You know what I'm saying? Whose is this? I can't believe somebody left this in the elevator. And so I can't even get upstairs. Linnea, can you help me? Something's in the elevator and I can't get upstairs. Can you guys hear me? Hello?
Yes, we hear you, Karen. There's something in the elevator.
Yeah, I can't get up, but you know, and so for me to always to be told, oh, this is the rule and this is the way you have to act around white people. This is the way you have to be. You have to change all that. You can't be who you are, who you were born to be, who your mother was, who your grandmother was. You can't be that here. You know how that sounds to me? It's like, I don't know. It's like anything. It's like, for me, you guys, it's very offensive. Yeah, it's very offensive to me. And that is why you get me angry.
We lost you again, Karen.
I'm not an LEC member right now. And I started it. You know what I'm saying? People don't understand and don't know the history of the LEC. You know what I'm saying? How the CAC board and all that had all this stuff developed. We stood up the King County Regional Homeless.
You're really going in and out, Karen.
Karen, can you hear us?
Mad, always complaining about something. The reason I'm always mad and always complaining about something because my people are still suffering constantly, and I'm not going to be quiet. I'm not going to shut up. I'm not going to put up with it. I'm not free until we're all free. And as long as they're freezing outside right now, how can I shut up? I'm not going to shut up. So kick me out, put me out, vote me out, do what you do. I'm never going to be able to sit at a table with the people who oppress all the different cultures of the people that I love, the people that I respect, the people that I take, no matter how they come. I love them anyway. If they cuss me out, I love them anyway. If they assault me, I love them anyway. You know, that's who I am. That's the difference. And if I'm not wanted because of that, you know, people want to say, point out other people's flaws, but not look in the mirror at their own. You know what I'm saying? We elected the chairs of this meeting, and that's who I look to for my guidance. Not saying other people's voices don't matter, because they do. We all come with a lot of trauma. My bag just may be a little bit more fuller than yours. And then I don't even really know that because we're not really relating. I don't like being watched. I started all that to say, I don't know why everything we do is public now. Everything we do is aired out so people can sit there and speculate and judge me. I'm not here to be judged. I'm here to speak the truth that I've lived and that I still experience every day, you know? And I know I'm long-winded and I'm very emotional and I am crying, but I don't care. Until the day they put me in the ground, I'm gonna speak up for what I believe is right. And if I need to be corrected or talked to or whatever needs to happen, I'm ready for it. Okay, because I'm not ashamed to be who I am, who my grandparents dreamed and their grandparents dreamed for me to be free and to have the ability to thrive and live and survive. Okay, so I'm sorry if I offend people. I'm sorry if I get smart aleck and get mad and don't say why, just act a fool. I'm sorry. That's part of my mental stuff, okay? I think everybody in this room has some mental things. A lot of us don't talk about it, but I talk about mine. So I'm gonna shut up right there.
Thank you, Karen. I have us at 3:59. Is there any other topics for committee discussion before we conclude this meeting? I want to thank everyone who attended from the public for joining us today. I also want to thank all of the board members that took time out to get this work done. Shanae and I will be following up as soon as possible with an agenda. It will be short turnaround. Do not be afraid to let us know if we've missed anything to be put into our retreat. With that, I'll call the meeting. Thank you.
Thank you.
Thank you all for showing up and showing out. You're appreciated. And I hope to see everybody at the retreat.
You got it.
Catherine, you can close the meeting.